And many women I see in clinic have this as well, and it's very traumatic because you go from having this thick hair and all of a sudden your hair is just falling out in clumps. So I think with patients who may be exhibiting a telogen effluvium, I do recommend doing a supplement because sometimes it's due to like an iron deficiency or a B12 deficiency, a vitamin D deficiency. So in those situations, I do recommend a supplement.
Hi, skin friends. Thanks so much for tuning into this week's episode of the Skin Reel. This week, we are talking all about hair, and I'm joined by dermatology resident Dr. Hannah Kopelman. She is going to be sharing all her insights and pearls after having completed 2 dermatology focused fellowships, one at Columbia University and another one at Boston University, where she also got her MBA. She's doing a lot of cool stuff. I definitely wasn't doing this much entrepreneurial stuff as a resident. She has a derm focused podcast called Derm Club, and she is also co founder of Derm on Demand, which is a teledermatology platform offering comprehensive dermatology care virtually. So she is doing a lot of cool things, wearing a lot of neat hats, and I am so excited to be getting her pearls and wisdom on hair loss, especially for women who are really premenopausal, who are maybe in their 20s to 40s who are struggling with hair loss, because we treat that a little bit differently. So if you are struggling with hair loss, you are definitely going to want to stick around. Dr. Kopelman, thanks so much for being here. We have been trying to connect for so long, and I'm so glad it's finally happening because this is a topic I know that is near and dear to my listeners' heart and my own, and that is hair loss, especially for women. So thank you so much for being here.
It is so great to be here. I remember when we reached out initially to each other, and that was quite a while ago. So it's good to finally make this happen and sit down with you today.
You're in your dermatology residency right now, and I definitely want to dive into how you got interested in hair loss. But I always love talking to other derms about hair loss because up until a few years ago, I thought it was just something that men were worried about. And then I hit my 40s and I've always had thick hair. And I thought, wait a minute, is my forehead getting bigger? Am I losing hair? And most people looking at me would say, oh, don't be crazy. It looks fine. And I know a lot of women get that feedback, right? They'll say, I'm having hair loss. And people look at them and say, well, your hair looks great to me. I don't see the problem. Do you find that that happens a lot?
It's a very common misconception that hair loss only occurs in men. But more and more, I am seeing more females in the clinic and more females approaching me really asking for help because as we all know, it's probably more acceptable for a man to go bald, but less acceptable for a female to experience that. So women are desperately searching for options on how to maintain their hair because it's one of the first things you see when you look at someone. And personally, I love my hair. I know how it feels, and it's very emotional if you start to lose your hair or it starts to become more thin.
For women, we feel that our hair embodies femininity, right? I'll even hear people say, like, I'll never cut my hair because they feel like they lose that femininity that they have. And I think this is especially hard for women going through things like breast cancer treatment, right? They sort of have like 2 hits to their femininity, right? They maybe are having a mastectomy and they lose their hair with treatment. So it's definitely very emotionally charged, not just for men, but especially women, I would say.
Yeah, it's funny you say that because my mother actually went through breast cancer and I was really young at the time. And I remember her telling me I'm going to lose my hair. And she went and through this whole experience of getting these very, fancy wigs. And I just remember it being very traumatic. And that was probably the first inspiration or my first interest in hair. Probably was dates back to that time.
Well, I'm glad you brought that up. I would love to know how you got interested in hair and hair loss.
Yeah, so again, as I mentioned, my mom had breast cancer. I remember going with her to pick out the wigs that she was going to be using during her cancer treatments. And then later on, when I was pursuing my career in dermatology, I spent some time at Boston University doing a skin cancer fellowship, and they needed an extra hand in the hair clinic. And it was very special to be involved in this clinic. I really didn't have much experience in hair loss at all or didn't really know what it was. And quickly I got acclimated. I had a really good mentor who taught me everything about it, all the different types of hair loss, which we'll get into today. And we went and did biopsies. So that was my first experience and exposure with hair loss. And I realized in the clinic that it was not just a cosmetic, disheartening thing that is like, oh, it's just cosmetic. It's like, people might think, like, oh, why do you need Botox? It's just fixing some wrinkles. But these women and men were coming in so emotional. They would come in almost in tears. And you would have to not only counsel them and educate them about their hair condition and their hair loss, but really sit down with them and get on their level and be there for them emotionally. So I was really drawn to it immediately at that point, and that's when I started to pursue further research in hair loss as well.
These are not quick visits, right? These hair loss visits. These are complex. And I would just tell anyone listening, if hair loss is a concern and you're seeing your dermatologist, don't wait until the last minute of the visit to bring that up, right? That should be like what you lead with, because it takes time and it can be very emotionally charged. And this isn't something to rush through. So these visits, they're long and lengthy and a lot goes into them, right? Because hair loss, like you said, it's not just cosmetic. There are a number of medical reasons why someone could have hair loss, and it's important to dive into all that.
Yeah, absolutely. And it takes a lot of empathy to really understand where your patient is coming from.
Like I was saying, I noticed hair loss on myself, which I don't think anyone else would have noticed. In fact, no one said a thing to me, but I felt like I was losing some hair and it was thinning. And I know if I wasn't a dermatologist and I had gone to see someone, I probably would have heard, oh, it doesn't look bad to me. It looks fine, sort of dismissal of hair loss. And I know that happens a lot for women. They'll have thick hair and they'll say, my ponytail's not as thick, or they'll notice thinning. And a lot of times, if it looks okay to the observer, they'll tell them, you're fine, don't worry about it. Do you hear that story?
Yeah, I always tell patients, you know yourself, you know your body better than anyone else. I actually experienced very similar situation to you where I started noticing maybe like a year or two ago, some thinning right up here. And if I went to anyone, they'd be like, "You're ridiculous. You have so much hair. It's so thick. I would die for your hair." But I'm like, "Yeah, but I'm looking in the mirror and I'm seeing for the first time in my life like see-through. I see scalp and I'm not used to that." So you have to really address what someone's feeling and what someone's seeing. You can't just dismiss them and be like, "You have gorgeous hair. It's thick. Don't worry. There's more serious things in this world." Because it matters to them and that's what's most important.
Yeah, if someone gives you that response, it's time to find a new provider, if you will. So let's dive into what are some of the common causes of hair loss? Because hair loss can come from a variety of things, but what are some of the common causes of hair loss for women?
So, number one cause is androgenetic alopecia, which is also known as female pattern hair loss. And this is most likely due to genetics. So, if your mother, your father, or someone in your family has thinning of their hair, then you probably inherited it from them. And it's, by the way, it's a myth that it only comes from your mother's father. It's polygenetic. So, you can blame both your parents.
Yeah, let's stop just blaming them. I hear that all the time. So I'm so glad you brought that up, because it's not just that straightforward and simple.
Exactly. And with androgenetic alopecia, you'll see usually diffuse thinning of the hairline. It's not necessarily along the frontal scalp. Usually, men are more affected in the frontal scalp, but it's typically along the hairline and towards the vertex and the crown of your scalp. So just keep that in mind if you're a female. One of the number one things that I usually tell patients is part your scalp and you will see if your part is starting to widen, and it's actually called the Christmas tree distribution. So if you start to see like this widening as you go towards the back of your scalp, that may be one of the first signs that you're having thinning of your hair.
Sometimes people say it's just not as thick when I put it in a ponytail. And for me, I had sort of that show through that you mentioned where I just felt like, whoa, I've never seen so much of my scalp before when I'm looking closely. So, yeah, it's different from what men will experience. But is it sort of the same reasons that androgen response? Is that what's driving this, or is it more complex?
It's more complex. I mean, I'm sure there are many other reasons that we don't even know yet, but what we know at this point is it's both genetic and then due to an androgen sensitivity. So we believe that if you're starting to witness some hair thinning, hair loss, a widening part, then it's probably because those hairs are becoming more sensitive to androgens and it's causing the hair to thin.
I feel like I'm hearing a lot of women talk about getting on testosterone. And I know it's a little bit like controversial, but could that potentially worsen hair thinning for women?
I'm so glad you brought that up because probably about a month ago, I had a patient come in who was on testosterone pellets and she was having dramatic hair loss. And she's like, I don't understand what's going on. And for sure, hands down, it was due to the testosterone. She said that she was on it for, this energy boost. She was starting to become postmenopausal and she really just wanted also for that sex drive to maintain it. But as a consequence, she was getting hair thinning. So we really had to discuss like maybe you should not continue with this testosterone. And sometimes women don't want to forego the increased sex drive or the increased energy they feel with testosterone, and they're trying to do treatments to maintain their hair. But I think the treatments that we can offer are almost band-aids unless you can fix that underlying cause or the underlying reason.
I've seen that too, and also an increase in acne, right, with the increased testosterone. So, like most things in life, it's sort of there are pluses and minuses, right? And you have to decide, well, what is your number one goal? Is it that increased energy or sex drive, or is it maintaining your hair? Because it does require a little bit of balancing, and there are pluses and minuses. Yeah, and like if she stays on the testosterone, you could conceivably give her anti-androgenetic medication, right? But then you're kind of, like you said, putting a band-aid. You're not really getting to the root cause, which is that elevated circulating testosterone.
Right, and you're kind of masking the real, like, symptoms or causes. But, yeah, many of these women, the first time they're like, "I've never had acne in my life, I'm breaking out," and we usually know what the culprit is in that situation.
As I'm hearing a lot about testosterone for women, I think this is something we'll be seeing more and more. But what are some treatments? And let's start with like supplements, right? Because supplements are all over the place for hair loss. Do they work? I get this question all the time. My staff, patients, should they be taking a supplement for hair loss?
I think it's really tricky. So, we mentioned androgenetic alopecia, which is the most common cause. And there are a few other common causes, telogen effluvium, which is, this rapid shed and hair loss, usually due to some stressful trigger or recent illness or hospitalization. And many women I see in clinic have this as well. And it's very traumatic because you go from having this thick hair and all of a sudden your hair is just falling out in clumps. So I think with patients who may be exhibiting a telogen effluvium, I do recommend doing a supplement because sometimes it's due to like an iron deficiency or a B12 deficiency, a vitamin D deficiency. So in those situations, I do recommend a supplement. But I'll get into in other situations why I wouldn't. The other common cause of hair loss or hair thinning that I see is PCOS, polycystic ovarian syndrome. This is very common. I would say most common hair loss that I see in premenopausal women is due to PCOS. If you have PCOS, I don't think a supplement is going to solve your problems. So you really have to first do like this breakdown approach and say, first of all, what is the culprit? What is the cause of your hair loss? And yeah, there can be overlap. Someone can have PCOS and they can also have androgenetic alopecia. If you have androgenetic alopecia, I think, or female pattern hair loss, there's a limit, in my opinion, to what supplements will do. There's so many supplements out there. My friends always say, should I sign up for this and should I subscribe to this? And I'm like, listen, it's worth a try if you wanna go the natural route. I'm not gonna say it's gonna hurt you, but I don't want you to have totally high expectations. I think for women, it's very difficult because there's limited options for us, especially if we're in that childbearing age. Some of the medications that we use in male pattern baldness are not necessarily safe for females, especially if you're planning on conceiving, if you're currently pregnant, if you're breastfeeding. So you're kind of like in a very difficult position. Like, I want to do something natural, but I don't want to lose my hair. What do I do? So for females who want to do something natural, who are in that childbearing age, I do say try a supplement. But I always tell them, let's see if you even have a vitamin deficiency before we like rush and spend from millions of dollars or a lot of money at a supplement. And maybe if we do find that you have an iron deficiency, a vitamin D deficiency, a zinc deficiency, B12, then at that point, we can fix that specific deficiency and you'll see a difference.
Are those the common labs that you do check?
Yeah, I would say, thyroid, iron, B12, vitamin D, zinc. Those are kind of the holy grail labs that I would check if someone is having hair loss. Yeah, and then if you have PCOS, there's other blood work we could do as well, including checking your androgen levels, like your testosterone, and seeing if your hormones are off balance. And then we have great options for you if they are.
Everyone nowadays wants to get to the root cause, right? So making sure you don't have a deficiency, because if you're hypothyroid or hyperthyroid, by correcting that, your hair loss may solve itself, right? Or vitamin D deficiency. And that's something you can very simply correct with a supplement. So, yeah, making sure you rule out these medical causes, I think is really important. I like that you mentioned the women who are in the childbearing ages. Right. They are limited in certain medications that they can take. So a supplement may be helpful here. What about supplements that have things like ashwagandha and a lot more of these botanical ingredients? Do you find that that can be helpful? Because I feel like I have two camps. I have people who swear by it, and then I have people who are like, I don't know if I see a difference.
I think that we are learning more and more about these new like botanicals and like saw palmetto, rosemary oil. I think topically, I think these do have some impact on helping to thicken our hair. But taking them orally, I think there's more research that needs to be done. I do want to mention one very common supplement that I'm sure a lot of the listeners have tried or have heard of is biotin. So, biotin, we used to think this was the supplement that you need for your hair, your nails, your skin. And we have actually found out that biotin can cause some false lab results. So, I just want you to be aware that if you're on biotin and you're trying to figure out what is causing my hair loss and you're going for blood work, I would probably advise you to stop that biotin for probably up to 3 months before getting your labs checked so you can make sure you have, you know, more accurate and precise results because they can sometimes increase or decrease your thyroid levels and your hormone levels. So if you're trying to pinpoint what is causing your hair loss, and it may not be any of those things, just be aware of biotin.
Yeah, I'm glad you brought that up because I feel like there was a time period, and some people are still on just obscene amounts of biotin, right? Like 10,000 micrograms plus. And it's sneaky because you might be taking a bunch of different supplements for hair and skin, and each one has biotin in it. And when you add it all up, you're actually taking really, really high doses of it, much higher than you realize. And it doesn't work. So there's really no point in being on it unless you truly are biotin deficient, which is really, really rare. And it can interfere with important blood work. So thank you for bringing up that point. That's really important.
Yeah, I usually tell patients, unless you're homeless, living on the street, and, a really severe alcoholic, and you're not like eating properly, then you most likely don't have a biotin deficiency.
Yes, right. They're probably not coming to see you for hair loss then. What are some of your favorite treatments then for hair loss? And let's sort of start with like someone your age, childbearing years, they're noticing thinning, don't have any blood work abnormalities. How would you sort of approach that?
So I really like to use spironolactone. I do think it makes a difference in both your hair loss, your acne. if you're getting hair on your chin. So I think spironolactone is a great place to start. Also, especially if I think back to my friends who I advise, most of them probably have maybe not diagnosable PCOS, but they have some visible signs of PCOS. I find that spironolactone really does work in those situations. I also really like minoxidil. If they're looking for just, they don't want to be on medication because many people my age are not on medication. So asking them to take a pill is like a big deal. So I say, you know what? If you want to do something simple that you don't have to ingest, start with minoxidil, start with like a Rogaine,
And you're talking topical.
topical Rogaine. Yeah. It's a great place to start. I say, leave a can of Rogaine. This is what I do next to your toothbrush or next to your sink. And in the morning, I like the 5% foam. Spray a little bit into that area wherever you're having that hair loss. Massage it in for a few minutes, and then you're done. And you can do it once or twice a day. I think this is a great place to start. However, some people, become less and less compliant. I'm guilty of this. I was really good with it for like maybe 3 months. And then I kind of was like, I gave up on it. So some people just prefer a pill because it's easier. So you can also do the oral version of minoxidil. And for women, I like to start at a dose of 1.25 milligrams. I feel that this is a good dose that doesn't cause side effects for women. However, I do, I see many women coming back and saying, "Ugh, I can't stand this. I'm growing so much hair on my chin." So if you are someone who already has a lot of hair on your chin, or if that's just like a big factor or like a big no-no for you, then you're probably not going to love being on the minoxidil. But I do find that it works well.
I will just give my 2 cents on that, right? Because I tried using topical Rogaine, and yeah, I could not commit to doing it twice a day. I don't like to wash my hair all that often, and I felt like it was getting goopy in there. But one thing that I think is a neat hack, if you are doing Rogaine, put a little on like a mascara brush, a clean one, and put it on your eyebrows, because I was having eyebrow thinning because I grew up in the 90s, 2000s, and, thanks to Gwen Stefani and all these like people who are over plucking their brows, my brows were over plucked. And so I was noticing thinning there. So you can also use it on your eyebrows, which is neat. And yeah, the topical works great. It's just compliance, right? Doing it ideally twice a day, do the 5% foam or liquid, do the 5%, I should say, even if you're a woman, right? It says it's for men, but it actually works better. But I did switch to the oral just because it was just simpler for me. I'm already taking vitamin D, so I already had that going in the morning. And I have not had any side effects. I have not experienced that increased hair growth. So I'll usually tell my patients, yes, that's a possibility that you can get some peach fuzz. I do think if you are more menopausal, you're going to get that anyways. And so maybe that exaggerates it. That is sort of the main side effect. But I find a lot of my patients are just so grateful to have more hair on their head that they're like, whatever, I'll deal with the peach fuzz. So you do have to sort of weigh those risks, but it's such a low dose that even if you're on blood pressure medication, even if you have low blood pressure, like studies have shown that really doesn't affect that at such low doses, which is, I think, great for patients to hear.
Yeah, I usually tell patients it really shouldn't impact your blood pressure and take it with a full glass of water. Pay attention. And this is more on patients who are a little older and maybe on some blood pressure medications. If you're doubtful or you're a little bit hesitant about starting it, you can always ask your cardiologist, is this okay? But usually it doesn't impact it because it's such a small dose.
So tiny, they even cut the pill in half, right? They don't even make the dose that small. So that's a great option. What about things like PRP? And then I'd love to talk about exosomes and then laser. So, what do you think about PRP?
So I think PRP definitely has its perks, especially if you're someone who really doesn't want to be on oral medication. But I also think it's a great option if you want to combine it with all these other options, because I do think there's a synergistic effect. Women probably want to throw the kitchen sink at their hair to get as much back as possible. So if you're that person or you just want to get that synergistic effect, which is probably the most impactful, then yeah, PRP is a great option, which is we draw your blood, we spin it down, and then we inject the plasma into your scalp. And we believe actually what may be impacting the hair growth is when you're injecting the PRP into our scalp, we're causing little micro traumas with this very small needle that only goes like about 4 millimeters down to the base of your hair follicle. And we think that trauma actually brings growth factors into the area, which stimulates the hair growth. However, with PRP, you know, every day we can have different levels of nutrients in our blood. So today I might have more nutrients than tomorrow, and that can impact how well the PRP works. So I think another great option, which is starting to gain popularity, is mesotherapy. And mesotherapy is, again, a similar idea where you're causing that micro trauma in your scalp, but you're actually injecting medication. So you may be injecting minoxidil, like an injection form of the minoxidil into your scalp. And I think that works really well as well. In addition to PRP or mesotherapy, you do also have low level light therapy. I find that a lot of women like doing this. It's that red laser cap that you can put on your hair or your head a few times a week, and you can kind of do whatever you're doing while it's on your head for about 12 minutes. This is another great natural option. We don't yet know how impactful it is, but there's research being done. And I do think if you want to throw the kitchen sink, then why not put some red level light therapy on? And it can't hurt and it can probably only help you.
Again, it's just consistency, right? It's just making sure you're actually using it, using a laser, this thing with red light mask or these LED masks, right? You need to make sure that the bulbs are powerful, that there are enough of them. I find those like little wand things, I think you'll be disappointed with that. But if you've got a whole helmet or thing you're putting on and it's full of lights and it's powerful, it can help. And again, yeah, most people are trying a lot of different things. And maybe you wear it while you meditate or pray or read. And if you can commit to that, I think you will see results.
Yeah, I think as long as you're doing something towards working at it, you'll probably see a difference. Well, exosomes, we can get into that as well. But there's another oral medication. So you've probably heard of finasteride, which is very common for men to take. But there's also dutasteride, which is kind of like the sister drug of finasteride. And dutasteride actually binds 2 times greater to these receptors and can really work very well for hair loss. But I only like recommending finasteride or dutasteride to women who are past that childbearing age, who are usually postmenopausal, or if you're younger and you're just like, I'm done having children and I'm committed to not having any more, because there are some potential side effects to a fetus that we don't want to have, of course. So if you're past that point and you're no longer going to be having kids, I think dutasteride or finasteride are great options for someone with hair loss, and combining it with minoxidil, I think you can really see the biggest results.
Yeah, absolutely. I'm glad you brought those up because those are great options. Men can be on them. I would say the biggest side effect for men is that it can lower their sexual drive. So for some men, that's not acceptable. And I know for some men, they don't notice that side effect. Do you find that women have a decrease in sex drive when they're on these medications?
No, I find that they have almost no side effects on these medications. I find that their results are probably superior.
That's the same thing I would say. And they also make these in topical varieties. So again, just like throwing the kitchen sink at hair loss is important. If you find you've sort of plateaued on minoxidil or you're ready to kind of up the ante a little bit, you can get these compounded topical formulations that contain finasteride, dutasteride, sometimes tretinoin, a whole bunch of different ingredients to hopefully all work synergistically to help stimulate hair follicle growth. And those are topical. So those are safe really at all ages.
And then lastly, which is what you mentioned, is exosome therapy. And this is a type of regenerative medicine. And we believe the exosomes contain growth factors and other signaling molecules that can stimulate hair follicle stem cells, which would obviously create new hair growth. At this time, I do think that more research needs to be done. There were some stories about we didn't know where the exosomes were coming from. We didn't know how reliable the source was. So I think we're getting there. Personally, I'm not committed yet to using exosomes until I feel that they are 100% safe because I don't want to put my patients in any sort of danger. but I do think it could be a potential treatment in the future.
I think exosomes are like the one step up from PRP, right? And I totally agree with you. Like exosomes, I'm so into exosomes. I love it. I actually am using an exosome product for my skin and my hair. But what I will caution is you have got to be so careful where you are buying it and getting it from, because all these marketers, all these companies know that exosome is the next buzzword and they're slapping it on products. And, where are these exosomes sourced? Where are they from? What's the message in the exosomes? Because exosomes are just carriers, they're little envelopes, right? So there are only a handful of companies that I think are really doing a good job at this point. And I would just say buyer beware, be very careful. At this point, they're only approved topically. So it's not recommended to be injecting them or doing them IV, which I've seen. So it's a little bit like the wild, wild west. And you do just have to be careful where you're getting them from because there's a lot of gimmicks out there. But I do think it's really cool and something we'll be hearing more of. The other thing I'll mention that there are companies that are making, rather than relying on our own plasma for platelets, that are using platelet derived growth factors, which is kind of like taking the growth factors from platelets and just amplifying it tenfold, a hundredfold, whatever, so that you're really getting those growth factors in the skin as well. So, another thing to consider. But if you are struggling with hair loss and you've tried sort of the more basic things and you're ready to take it up a level, I mean, really see a dermatologist who can really help guide you on what's maybe snake oil, what could work, what may not work, what's still sort of experimental. Any experience with the Folix laser, Dr. Kopelman?
Personally, I haven't had any experience yet with the Folix laser, but I've heard some stuff about it. I've heard some mixed results. Some people are like swearing by it, and some people say, they need more time to see if it really works. So, definitely something to consider. I want to learn more about it myself, but I wouldn't be able to totally guide a patient on that yet. And like you said, for exosomes, I actually work with someone who does do injections of exosomes, but it like comes from his personal lab. So again, like you said, it's all about the source. I do think with the Folix laser, it's probably a similar idea to the low level light therapy where you're increasing that blood flow and you're stimulating that ATP production and energy to grow hair. So it's possibly a great option and a non invasive option as well.
What's important is that we actually do have things out there for people, and everyone's going to respond a little bit differently. This isn't cookie cutter medicine. It's not like do this and your hair grows back. A lot of times it's kind of trying different things, trying multiple things, coming at it from different approaches. And this is definitely an area getting a lot of research and interest. So I think it's an exciting time. I personally would love for someone to be able to reverse gray hair. And some of these treatments actually have been shown. I think by stimulating hair follicles, which are stem cells, right? Like that, you potentially can see some reversal of gray. So lots of cool stuff coming out. And again, I would say just there's also a lot of like bogus stuff. So see someone who sees hair loss, treats it on a regular basis. They're not just trying to sell you the one device or procedure that they do, and make sure it's not a medical issue, right? Like rule out that first. And we didn't even touch on all the other different hair losses and scarring hair losses. There's so many. So again, it's important to know what kind of hair loss you have and then sort of steer the treatment to that. Dr. Kopelman, this has been really educational and fun. I would love it if you could share just your top three pearls for someone maybe in their midlife struggling with hair loss who's a woman. What should they do? Like top three pearls.
So I would say number one is be patient. I don't have a miracle pill. I wish I did where I could say, take this, tomorrow you'll wake up with a full head of hair. Patience. It takes 3 to 6 months at minimum to see any sort of result or difference. So, and I know it's frustrating because it's hair is not a place you want to be patient. You want it to come back immediately. So that's number one. Number two, know that you're not alone. So many people are fighting hair loss. I think, women try really hard to disguise it and kind of hide it, but you're not alone. And there are communities where our, platforms, support groups where you can reach out and get help or get assistance. If you need to talk to someone, you can always reach out to me. I could talk to you about your hair loss all day long. number 3 would just be we have options for you. So don't think that this is the end of the road. Don't think you're doomed. We have options, and I think we can make a difference.
Absolutely. I love that. And I love that you said it takes time. It is not a quick fix. Stick with it. And you really are going to develop a relationship with your dermatologist because it's not a quick fix. It takes time, but hang in there and we'll work with you to try to find something that will help you. This has been great. Where can people find you, follow you? You also have a derm podcast, which is so much fun. And can you share that with the listeners?
Yeah, sure. So you can obviously take a listen to my podcast. It's called Derm Club. You can also find me on Instagram at Dr. Hannah Kopelman, and that's DR. I'm on TikTok as well as Twitter, LinkedIn. And if you need anything, you can reach out to me on drkopelman.com as well as dermondemand.com, which is a teledermatology platform. And I'm happy to help you with your hair loss through remote setting as well.
That's amazing. I love that. You're doing so many cool things. I will definitely include all of that in the show notes so people can find you and follow you and definitely check out her podcast as well. Thanks so much, and I'll see everyone next week.